Good evening, and welcome to the first of a series of 8 virtual town hall meetings being hosted by the Mississippi Department of Human Services. I'm Danny Blandon. What we hope to accomplish with this series is to offer some information on the services and the services provided by all 7 of our programmatic divisions within the agency. Also, we want to answer questions from you about how do you find out if you qualify for the services and how to apply for the services if you do qualify. Let's just hear from you on how we're doing, what we're doing well, and what areas we can improve in. With me is the Executive Director of the Mississippi Department of Human Services, Mr. Bob Anderson. Mr. Anderson, it's not often that the Executive Director of Programmatic Leadership of an agency opens themselves up like this to the public for 8 straight weeks. What made you decide you wanted to do this?
Well, like you just mentioned, Danny, we as an agency, we cover such a vast variety of areas. We provide a lot of different benefits. We wanted an opportunity to share information. There's always plenty of information for us to share. And Facebook Live, everybody's on Facebook these days. This is one of the best ways for us to reach the public and hear from them what we're doing well and what we need to do a little better. We want to be accessible. One of the commitments that I have made as Executive Director is to be transparent about what we're doing here and how we're operating this agency, and this is a good way to make ourselves accessible to our clients. And these meetings, because we have 8 of them, we're covering all our program areas, this gives us an opportunity to kind of drill down a little bit and explain each of our programmatic areas to our clients.
Okay. The year we just went through, 2020, was a challenging year to say the least. Natural disasters, a global pandemic, businesses had to close, even if it's just temporarily. For a while they had to close, people were out of jobs, child care centers had to close. Essential workers and health care providers were without child care for a while. Talk about a little bit about how we as an agency had to adjust to that and how it changed our lives.
Sure. I mean, the pandemic, when it reached its height, had an immediate impact on us in the sense that so many people were out of work and they were much more needful of the services that we provide, particularly in the Supplemental Nutrition Assistance Program, or the SNAP program. We saw our applications go up by the thousands each week, and we were having to staff our offices to work 6 days a week, sometimes 8-10 hours a day, just to handle all of those applications and to get benefits out to people. During the year 2020, we distributed something on the order of about $600 million in SNAP benefits. And that was a large increase over our average year. And the numbers, one particular month we had over 24,000 applications just in 1 month. So SNAP got really busy. We also had kind of a related program, but it's a different kind of program called Pandemic EBT. When the schools were shut down, the 3rd week of March, the free school lunch program ended. And we were asked to participate in a program called Pandemic EBT, where we would distribute to the families of those children who were eligible for free and reduced school lunches the monetary equivalent of what they would have gotten in a meal. We started that in the midsummer, and it took us several months to get all of the money out there, but we distributed benefits to over 350,000 children, over 250,000 families, and we're able to put another $100 million out there into the homes of families who depended on us.
Now, some of those, you're talking about the pandemic EBT, some of those we had to hand stuff the cards, but they weren't already SNAP recipients. And like 180,000 envelopes we had to stuff with cards and instructions on how to use the cards and get those out to people.
Absolutely. That was a lot of the challenge because about probably 2/3 of the families that we awarded those benefits to were already SNAP recipients, so they knew what the electronic benefit transfer card was, but like I say, 180,000 children, we sent cards out to them that we loaded here at the Department of Human Services. We had to actually take the card, load the funds on there, and send the actual card along with the letter explaining what it was out to families. And another thing that we dealt with was sometimes during the school year, it's very normal for families to move. And so some of the addresses we had were not accurate. And we spent a good bit of time trying to update those addresses and find those children so we could get those benefits out to them. And it was a pretty lengthy process, but we ultimately got all of them out and were able to award all the benefits. You mentioned child care a few minutes ago. We did a lot with child care during 2020. We actually created a new program specifically for first responders and healthcare professionals and others who, during the pandemic, had to have child care. And we have about 2,500 child care providers across the state. Well, somewhere on the order of 1,000 of those weren't even operating during the pandemic. And we raised up a program called the Child Care Assistance in Isolation Response Program, where we created a certification process and created some temporary vouchers to make it available for those first responders and healthcare providers and folks who were basically keeping their communities operating and caring for COVID-19 victims, make it possible for them to do their jobs and not have to worry about what they were going to do for their children and with their children for child care. And we created some specific training material for C-Care. We actually trained 585 child care providers through the C-Care program. Most of our child care providers have begun to come back online since about October, early November. They've begun to get back into the swing of things. And so we've kind of tamped down and are slowly closing down the C-Care program. But it's one of the COVID-19 victories that I think we as an agency really stood up to the challenge, made a difference for families.
Now, when that first started, that was supposed to be a temporary program. It's supposed to be a stopgap until the child care centers were able to come back online. But it grew into something even more, where we became the only place in Mississippi to receive, for child care centers to receive training on how to function in a COVID-safe environment. We had like 585 child care centers trained at one time.
Right. Yeah, we were training them in all the essentials about how to have the proper PPE material, how to clean the surfaces in the child care facility, what to do in terms of taking temperatures and having the hand washing and social distancing, all of those things, all the CDC guidelines that were passed on to us, we passed on to child care providers and also helped them learn how to deal with those in the context of a child care facility, which is a little bit different when you have 4-year-olds, 5-year-olds, 2-year-olds, and you're having to deal with constantly wiping down surfaces and making sure people are wearing masks and things like that in order to be safe. One of the ways we were able to do that was that we, as an agency, were awarded about $47 million in CARES Act money for child care, specific to child care. Those funds are earmarked only for assisting child care providers and families that are participating in child care. One of the other things we did last year with some of that CARES Act money was because attendance was down so much at a lot of the child care facilities, we began giving what we call booster payments, so to speak, to child care providers based on their enrollment in order to help them stay in business. And so a lot of child care providers benefited from payments based on their regular enrollment. We didn't track as closely what their actual attendance looked like because of the pandemic.
And again, C-Care was not an existing program, so it's something the agency took the initiative to create and then built it into what it was.
That's right. Yeah, our director and deputy director at that time, Christy McHale, and Chad Allgood, who's the current director now of the child care division, they created that themselves. They wrote the plan, they designed the training, and they began to push it out the door and train the child care providers and license them as C-Care facilities. So, like I say, that's one of our real success stories from 2020. Another thing we did a good bit of, because people were facing the reality of being thrown out of their homes, we provided rent assistance. Again, there was CARES Act money for our low-income housing energy assistance program. And we also had about $15 million awarded to us for rent and mortgage assistance in order to keep people in their home during this pandemic when people were out of work, particularly. Everybody was concerned, especially our poor population of some of the poorest in the state were dealing with staying in their homes. The CARES Act money we got awarded was very crucial to helping folks be relieved about not having to leave their homes.
And especially for our aging population, that low-income housing and energy assistance program is very important for us. You don't want them to be without heat during the winter and be without electricity at all. So now, how do you? And I didn't even realize until I began working here that there's rent and mortgage assistance receivers available.
Yeah.
So how do people that are in that position where they need that, how do they apply for it?
Good question, man. You know, we rely heavily. There are about 16 or 17 community action agencies scattered out all around the state, and we have a relationship with them. We have a contractual relationship with them, and they are our partners. And you can go to your local community action agency and put in an application for LIHEAP, for energy assistance, or for the rental assistance, and the community action agency will evaluate your application, and they actually are the ones who disperse the funds on our behalf. They're the flow-through agency that we use as our partner to administer those programs. And they have been just as vigilant as us in terms of taking care of families' needs as they were identified to them. I will say there is still a good bit of assistance available in those programs. We have not been reluctant about dispersing the money. We just haven't had quite as many applications for that assistance as we had expected.
And we talked about community action agency. We mentioned a little bit about the aging population and how important they are to us during this time, and especially during the time of the pandemic when they're so vulnerable. We also had the opportunity to work with the planning and development districts recently, where we were able to give families greater access to their loved ones in these long-term care facilities when normally they weren't able to see them.
Oh yeah, that was a great good news story that we were privileged to be a part of. You know, the planning and development districts are also partners of us, partners with us. Each one of them has an area agency on aging that is specifically tasked with working with our seniors in the state of Mississippi. And the northern half of the state, about 7 of the planning and development districts there, took advantage of a grant program and got a grant in order to distribute Chromebooks, computers, to 167 nursing homes so that residents of nursing homes could then have the opportunity to do events just like this. They have FaceTime calls and Zoom calls and other kind of virtual contact with their families when prior to that they could only visit like through glass at the nursing facility or in a special room for a short period of time. So we were very privileged to be a part of that project.
And this grant was secured by the Division of Aging and Adult Services.
That's right, yeah. Kenyatta Blake Washington, who is our division director that folks will get to meet in a few weeks. Kenyatta has a real passion for working with senior citizens in our state. And Kenyatta worked with Three Rivers Planning and Development District up in Pontotoc, and they put this grant application together and got it through. And the Administration for Community Living, which is part of the Federal Department of Health and Human Services, approved the grant and awarded the money. And we went up, and I think there were something like 400 Chromebooks that were actually distributed out to the 160 plus nursing facilities.
That's great. That's great. Well, we'll leave, as everybody has been so eager to do, we'll leave 2020 behind us. And let's talk a little bit about 2021. We're going into the legislative session, and I know you've set your priorities for 2021, where you'd like to see the agency go, and some differences you want to see done within the agency. Can you talk a little bit about that?
Sure. And we've got 2 or 3 kind of top priorities. One, we're looking to get law enforcement authority for our investigators. We created in this agency an Office of Inspector General only about 3 years ago. It seems like it's been here a long time, but it's been in existence only 3 years. But our investigators don't have the authority to act as law enforcement officers. And so we're asking the legislature to give us law enforcement certification authority for our investigators so that they can be full charge law enforcement officers. That's a big priority for us. One of the other top priorities, we have not in this state looked at increasing the monthly benefit amount for TANF recipients since 1999. And we have shared with the legislature, and the bill has been dropped in the House, a bill that would increase the monthly benefit amount about $100 a month for families that rely on our TANF, our temporary assistance to needy families, benefits that we provide to families. We've got a few child support related initiatives they sound like common sense, but the law is just not caught up with reality. For example, we still accrue child support responsibility for parents who are locked up in prison. Well, the federal law tells us we can't do that. We need to harmonize the state law with the federal law. And so we have asked the legislature to allow us as an agency to suspend a non-custodial parent's obligation to pay child support while they're incarcerated. When they get to a halfway house or a restitution center or something, that responsibility will pick up again. But while they're incarcerated, obviously they don't have the ability to pay child support. So it's just a common sense change. We have some similar ones like that related to child support, allowing us to look at a non-custodial parent's true family situation, their true employment situation, before we reach out and take a lump sum amount of money. Say somebody gets a bonus or they win something in the lottery or whatever. Right now, we can essentially reach every dollar. The bill that we tendered to the legislature requires us to look at the circumstances and whether that that parent who's obliged to pay child support is maybe already supporting another family, another child in another family, and what their whole financial situation looks like. Those are some, like I say, some common sense changes. We are also pushing some technical bills to allow us, I should say, to change the SNAP certification process back to what's called simplified reporting. Right now, our clients, when they have a change in their income of just $100 in a month, they're obliged to tell us, and we're obliged to recertify them based on that $100 change. $100 is really not much. that could be a weekend of overtime or something. And we're asking the legislature to let us go back to the simplified reporting idea where we reach 35 families every 6 months, and we get their financial situation and resources every 6 months, like we've been doing in years past.
I know you said from pretty much the day you got here, that you would like to see tenant benefits increased, and for us to be able to provide more assistance to those families that need the temporary assistance. It doesn't seem like a lot of increase, but when was the last time there was a TANF increase?
Yeah, that's a good question. We have not increased the TANF monthly benefit in Mississippi since 1999. So even if the legislature passes our bill and the governor signs it, it still will have been 22 years by July when the bill would be, become law, since we increased TANF benefits for families in Mississippi. I think we would agree the cost of living has gone up a little bit since 1999.
Yeah, that's a great thing. Well, let's go to some questions now that we're getting in. First question we got in is, will Mississippi be approved for pandemic EBT in 2021? Now, I know everybody received their benefits back in the spring, but that was a reimbursement for the time when families with children in the free or reduced cost lunch program weren't getting those lunches. That's not the case now, is it?
No, it's not. I mean, we have not, as an agency, decided to re-engage with the pandemic EBT program for this school year, or this calendar year, actually, the rest of the school year. The Department of Education has been awarded a grant that will allow it to provide some assistance to families, and we're going to see how that checks out right now. But for the moment, the Department of Human Services is not going to re-engage with the pandemic EBT program for the time being.
Another question is, when will the 15% increase in SNAP be added? Now, I want to remind everybody that in about 3 weeks, we're going to have the division director, the leadership of the Division of Economic Assistance Eligibility that will be here on this program. And a lot of these questions can be answered in a lot more detail during that time. But do you want to wait until then, or do you want to take that one?
Well, I mean, the 15% increase will be added as it is approved, as families are approved for SNAP, and as we're providing the funds through FNS. At the next certification round of verification.
So that's a federal program, so we're waiting on the Fed.
Right.
Okay. Right. Here's one question that was sent to us ahead of time, and I know one of the things that other direction you wanted to go in when you came in here is you wanted to make certain that all sub-grants are awarded through the competitive procurement process. Right. Okay, and I'll just read the question. MDHS has implemented new controls to ensure grant funds the agency administers are better accounted for. And they ask, how is the public able to see this occurring? Well, I think transparency is one. I mean, I put out a news release every time we open an RFP. Right. And people can go to the business
business
opportunities. Thank you very much. It's on our website. Sure. And can see when the sub-grants are awarded. Is there anything else that we do that allow openness and transparency in this process?
Sure. I mean, you mentioned already, we put out press releases when we release an RFP. We also, once we make an award, we have been putting out press releases about those to whom we've made awards, how many we've got, how many we evaluated. For example, we did an RFP for TANF sub-grant in July that was approved. We evaluated it and approved it, those to become active in November. We had about 46 proposals, but we only approved about 9 of those. But all those have been published on our website, published by press release. And, we're in the midst right now of reviewing a new RFP that we issued in November. This will be for work that will begin in mid-March, I believe. As soon as we have an evaluation committee that's both staffed by our agency and also by some folks outside our agency, again, for the purposes of transparency and looking to the expertise of folks who have expertise on things like after-school programs and the parenting initiative and other parts of the TANF program. As soon as we evaluate all of those current proposals and decide to whom we will grant, we'll award some grants, we'll make that known on our website. We'll make that known on social media, other social media. We'll issue a press release, and anybody, any member of the public is free to contact our compliance office. We have a privacy and public records function in our compliance office, and our privacy and civil rights officer fields public record requests every day. Anybody who wants to know about who the sub-grant awardees were, they can submit a request. We're happy to provide that information.
Okay. One more question that we got, and I think this one's going to be pretty easy to answer because, again, it's a federal program. They're asking if we're going to receive supplemental SNAP benefits in February. We won't know that. We made the request, but we won't know that until
Right.
USDA tells us that we're going to get those funds.
Right. We have a good relationship with the Food and Nutrition Service, but they don't tell us until they tell us.
That's right.
We don't know until they say whether we're going to be awarded those supplemental benefits.
And I can speak firsthand that as soon as we get that information, we will be pushing it out to you. So just continue to follow us on social media and watch closely, and we'll get that information to you as soon as we can. Well, that's about all the time we have for tonight for this meeting. Thank you for joining us. Again, next week we're going to have the Division of Community Services that will be joining Mr. Anderson. The Division Director, Tina Ruffin, will be talking more about programs like LIHEAP and rent and mortgage assistance. And again, if you want to submit questions ahead of time, just submit them to mdhs.communications@mdhs.ms.gov. Once more, that's mdhs.communications@mdhs.ms.gov. And again, next week, so we can get questions answered that are specific to what we're talking about and get as much information out to you as we can about these benefits and these services that we have available. Please make your questions specific to those services. And look forward to seeing you again next week. Mr. Anderson, thank you again very much for agreeing to do this. And we'll pick it up again next week.
See you next week.